Over to you, James.
Hi everyone, I'm James Bay. I'm a doctor of Chinese medicine, and I'm also a father of a craniopharyngioma survivor. My daughter's name is Samaya. At first, I want to thank CHOP and the Raymond Wood Foundation and also Amy Wood for doing such a wonderful job of putting this all together for us. So I'm joining you today as a care provider or clinician, but also an independent researcher, and mostly speaking as a parent and an advocate. So the topics that we'll be going over today are mind, body, and meditation self-care practices for caregivers, also care providers, and for cranial survivors. So I would love for you to stay involved. Feel free to post in the chat and we'll have a little interactive session. As we begin, I just want to share a video of me and my daughter just to give you a little sense of how we can work with our young ones or adolescents. And this is a video here of us and mind the clothes. This is off the cuff. We were on a camping trip and we were practicing Qigong together, which is similar to Tai Chi. I'm going to put this up here. So this is my lovely daughter, Samaya. We're in upstate New York. And she's leading me in self-care practice called Qigong. And one of the reasons I'm sharing this video, besides activities in nature for attunement, is also to share something about mindfulness. And here I'm not following along so well, so I got in trouble for that. And one thing I noticed while watching this video later, these mind-body practices are about attention. And at a certain point, you'll see that there's a little interruption. A big bird comes by. And this internal focus that we're generating through this physical exercise, it's also a training in attention that can help us with, here we are, something alarming in the environment, and bring ourselves back, just like we do practicing meditation. When a thought arises. Now, at this point in the conference, pardon me here. The conference often shares some mind-body practices like yoga to shake off the day from a lot of information. And I'm going to focus today's presentation. I won't be able to see you because this is a webinar, but I have a long presentation, and let me just share the end and the beginning, and we'll see where we get to. So, can we see this presentation on the screen?
We can, thank you.
Okay, great. So this is the end of my presentation. And what I wanted to share with us all is a mind-body research which I've been developing. And I know a lot of parents and caregivers among you all also involved and interested in mindfulness, meditation, yoga. So part of this work that I've been doing is a collection of resources. I've been contacting different organizations that teach meditation, yoga. I'm also a mind body educator, and collecting resources, meditation apps, websites, and a lot of these organizations are starting to respond back and also offering their classes, online classes by donation. And I also want to thank our care providers, because as we are discussing self-care, we realize it's a network, a stewardship in a sense. And in my time working in medicine, I really haven't contacted such humanity in our neurosurgeons, our endocrinologists. I'm really thankful for the other presenters. So a lot of these resources, I'll reach out to Amy Wood or the other conference organizers to see how we can get these to you if you're interested. They're also for the care providers. One of the topics we'll discuss is caregiver burnout, also referred to as compassion fatigue. So let me move to the beginning of this presentation here. We're going to focus more on exercises. So I'll just share a couple tips. And what I've done as a researcher is do extensive review of the literature in a number of fields, including meditation, yoga, qigong, mindfulness, types of meditation called focus or compassion focused, and highlighted some of the institutions that are offering them, how it's impacting education, and basically all the resources. So let's begin with this presentation. Now, just a disclaimer, none of what we're going to do today is prescriptive. I want to give you a little tour of the spectrum of mind-body practices, but for our cranial populations, a lot more research has to be done. And that's one of the reasons behind, or the intentions of gathering all of this research and promoting it and promoting discussion. The NIH has a department called the NCCIH, which grants for studies in mind-body practices and also acupuncture. I won't be speaking about acupuncture and other complementary therapies today, but I'll be going through some of the other disciplines that are really important to self-care and that are supported by the NIH. And with this in mind, I've paraphrased just a couple points. We can, and it's really important, back in March, around the second week of March, on the Harvard Medical website, one of the physicians wrote a blog and said, look, we're heading into the pandemic. I know many people will be cut off from their sources of care, their care providers, staying at home and dealing with a lot of stress. And we know this well. What they suggested was meditation, mindfulness, and yoga. I'll share with you some of the breath practices they were suggesting, as well as many more that have substantial study behind them. But what the NIH suggested here was that, yes, we probably use meditation apps, yoga apps, but when it comes to interventions, none of these, for example, for yoga, therapeutically, are prescribed interventions alone. They're usually studied or suggested in conjunction. So always we suggest referral. And for those that you're learning these mind-body therapies, if possible, there should be some professional regulation. So I'm discussing safety. And people that are sharing these with our families should know a little bit about our background, our condition, and very important is accessibility. So we want to be able to maintain this. And that's one of the reasons behind this resource. or the development perhaps of a toolkit. And lastly, there should be some communication with your providers. So anything that we take up other than basic yoga and meditation, we should discuss with our providers. Now, we receive so much benefit from these life-saving interventions. And I wanted to broach the conversation about quality of life. It's a concern for all of us. It's a consideration behind all the choices of interventions. And with quality of life, I want to discuss these mind-body practices and move beyond notions of just necessary care and survival to health and flourishing. And a lot of these ideas come out of psychotherapeutic literature, and a lot of these constructs are shared in research in mind-body fields. One of the main topics is about burnout versus well-being for caregivers. And it's important not to see that taking care of ourselves is selfish, but for the health of our relationships, for the benefit of our loved ones or our children, taking care of ourselves, making sure that our needs are met and that we're not overextending is really essential. And meditation, yoga, I'm sure many of you practice these yourself. So in brief, what is a mind-body practice? So as you saw, we were practicing a form of meditative or mindful movement called Qigong. You're probably familiar with Tai Chi. And some of the things that they can benefit, just as an anecdote, right before the start of the pandemic, we at home did most of our post-surgical rehabilitation. So I joined you as a new parent, and I have some background in orthopedics, rehabilitation, and physical therapy. So, I can do the evaluations myself, but we're left at home, and many of you were likely at home as well. And we've seen, as you've seen with my daughter, good progress in terms of rehabilitation, making sure that there's coordination, muscle strength, improving gait. And there's a lot that these specific mind-body disciplines can add to our repertoire, like moving from gross to more subtle movements you might have observed. But most importantly, and working with children, we speak about mindfulness. And one of the main aspects of mindfulness is just getting in touch with our own bodies, sensations, or internal awareness. And we're practicing together. And I think it's really important for cranial families or caregivers, especially parents of young ones. We know that energy levels can be challenged. There's changes in motivation. And so we have to have ways to get our exercise in a way that's sometimes, we have to get their interest, and that involves sometimes coordinating and working together. But there's more to these specific types of mind-body practices that may be different than other forms of exercise. And we know the essential impact of exercise on mental health or mood regulation, physiological regulation. So it's an essential component for us. But there's also a lot of research in how exercise improves cognitive function, mood regulation, and here attention. So let's speak a little bit about mindfulness, and we'll get into practices of mindfulness, compassion, attention meditation, which is really important for school, And I know many of you are homeschooling, so you may see the immediate impact of some of these practices on mood and attention. So mindfulness basically is about dropping into our own bodies. So why don't we begin as we're going through this presentation? If you feel comfortable seated posture, keep the spine elongated and seated upright. And just take a moment to check in. Notice any sensations, the quality of the breath, any thoughts or feelings, how you're feeling at the end of this wonderful day of presentation. And begin to anchor your attention into the breath. Simply note the quality and sensation of the breath as it enters your nose, throat, lungs. Notice the rise and fall of the abdomen as the breath enters and exits. And keep this attention on the whole body or just the breath for a couple moments. Noticing the inhale, the effect of the mind on the patterning of the breath as you inhale and exhale. Establishing a sense of curiosity and openness to your present moment experience. And as we drop in, a little bit about mindfulness is attending to our experience without critique, without judgment, just noticing what's present in our body, breath, mind, and emotions. Let's do this for 2 more cycles of inhale and exhale. And then we'll move forward. Now, feel free in the chat if you'd like to share if that was easy or challenging. And I want to share a little bit about how mindfulness can be specifically beneficial for our children and our loved ones. So mindfulness, one of its main components and benefits is described in a term called decentering. That's a psychological term that relates to being able to create a little space from our experience. And we know that's important for communicating, for addressing difficult emotions when we have to make big decisions, you know, around our treatments, when I'm sure many of you recall time in the hospital. We have to make quick decisions, and mindfulness helps create a little bit of space so that we can have a little bit more perspective. Let's see here. And so one of the main tools of mindfulness is locating one anchor for our attention, such as the breath. And when we're working with children, as you could see, tension is hard to garner. So we work with mindfulness in terms of games or sensory activities or being out in nature. One study looks at mindfulness for hyperphagia or Prader-Willi syndrome, and they looked at mindfulness-based strategies, including mindful eating, visualizing and labeling hunger, and shifting the attention away from hunger to meditating on the soles of the feet. So they saw positive results, so we can see that mindfulness has some prospect for different comorbidities and aspects of our health experience. And in terms of attention, if any of you have been homeschooling, we have all the children on the screen. Our kids are getting used to working with different apps like Zoom, and mindfulness and attention specifically is important for specifically for executive function, making good decisions, but also for working memory. So something that we realize that is that our children can have some difficulties with attention and memory following surgery or treatment. And so working with mindfulness through games and through play for shorter durations, some studies have shown that there can be benefit for memory and focused concentration and also select attention. So when there's a blip on the screen and they have to follow a different assignment, one way to work with some of these attention challenges is embodied mindfulness and through play. So I'm going to share a video of my daughter offering a meditation on mindfulness.
We're going to do some meditation right now, and we're going to sit in a relaxed space. If you don't have one, just try to follow along and see how it goes. So you're going to sit in a position where you feel comfortable. I would suggest sitting on a cushion or something instead of floor. It feels more supporting, and you're going to close your eyes. You can open, doesn't matter. And you're going to inhale through your mouth.
Let me get this video up. Thank you.
We're going to do some meditation right now, and we're going to sit in a relaxed space. If you don't have one, just try to follow along and see how it goes. So you're going to sit in a position where you feel comfortable. I would suggest sitting on a cushion or something instead of floor. It feels more supporting, and you're going to close your eyes. You can open, doesn't matter. And you're going to inhale through your mouth. And you're going to inhale through your nose. And exhale through your mouth. Inhale. Exhale. And if you're in a peaceful place, you can hear silence. If you're not, you can hear the beautiful chirping birds or whatever in your head, and you can imagine it. Thank you. Bye.
So there we see children can get interested in meditation. And like I was saying, We don't work with formal meditation with our kids, but oftentimes we work with sounds of nature, or going out into the environment and using exteroception, or the senses, and engage with play. Now, I want to share perhaps the most important part of this presentation before we just get into a number of physical practices, and that's about compassion. And I think for most of us, we understand the struggles of social belonging and the importance of it for a healthy learning environment. And sometimes we work with other parents or our social networks to try to gain understanding so that others will understand what we're going through and try to establish a social network of care. And the research on compassion for parents, compassion is explained as not only feeling the experience of suffering of another, but being motivated to alleviate that suffering. And as a caregiver or a parent, we immediately experience this. But when we speak about caregiver burnout, which many of us may come to at some point, the difference between compassion as a factor of resilience and this experience of burnout is often described as a lack of equanimity and an over-identification with the suffering, perhaps of our child or loved one. And it's really important that we stay attuned. Mindfulness, when we build this into our family network of care, or our practices of self-care, it allows our children to check in with their health state, but also to be more communicative. And that's also an aspect of mindfulness. And none of us are perfect. Sometimes we are completely available and present and helpful. And there are times where we can get burnt out. And so that's called compassion fatigue, or caregiver fatigue. So here's the slogan, kind of like a mantra that one care provider suggested, and it's, I can't fix everything. I can't take away this pain and suffering. Although this situation is challenging, I'm here and resolved to do whatever I can. And so when we notice that we're overextending, it's important to check in with any irritation or moments where we're just not able to connect. There's a requirement, and we'll see that perhaps we have to work with establishing a sense of peace, or the other term is equanimity. And when we're overly identifying, that's when we get exhausted. So that's an important insight from the literature. Now, another aspect of self-care, though, that we learn from mind-body practices, that if there's lowered mood, we work with practices such as developing kindness, loving kindness, compassion, and empathy, and try to work with psychoeducation in terms of developing positive mental states. So some of the practices around building compassion, which I call warming up, is to bring someone to mind who you have affinity for, like your loved one, and your child can do the same, and simply take a moment and bring that person to mind. And that natural feeling of affection or affinity is something that we contemplate and helps bring about more positive mental states, and we call that an upward spiral. So if we want to shift affect or mood, it's really important to work with pro-social meditations that can help with improving mood and resiliency. So I'm going to move to the last part of this time together and just share some simple mind-body practices. Now, the first one, many of us are dealing with anxiety, and perhaps the easiest way to work with anxiety is working with the breath. So in this Harvard meditation blog, they speak about square breath, and that's to get to know the contours of the breath. So if you would like to join along, we can begin with observing the 4 phases of the breath. They're the inhale, gentle pause at the top of the inhale, the exhale, and a pause at the bottom. So they call this square breathing, and you can start with a count of 3. So let's inhale together for a count of 3, gentle pause, and exhale for a count of 3, and a pause. We'll do that for 2 more rounds of the breath, inhaling for a count of 3, pause, exhale, and then pause. Now, another form of breath work that's used in yoga is called alternate nostril breathing. And this has been shown to downregulate the nervous system and create a sense of calm. I'm sure many of you have done it already, but we'll do a gentle and very simple form, nothing too complicated. So take your right index finger and close the right nostril, and you'll inhale through the left and close the left nostril, exhale through the right. Inhale through the right. Switch, close the right nostril, exhale through the left. Inhale through the left. And then exhale through the right. Now that's a common method of breathing used for self-regulation and calm. Most of the literature suggests deep or diaphragmatic breathing. So when we're stressed and there's sympathetic upregulation, we tend to chest breathe. So one of the features of breathing in yoga or qigong is to breathe in the low abdomen. So let's practice that together. We'll inhale both nostrils, filling the chest, the rib cage, and allow the belly to rise. And exhale. And then inhale again. Filling deeply, rib cages expand, the lower abdomen rises, and exhale again. And one more round of breathing. Inhale. And exhale. Another yoga breathing exercise that you might be familiar with is called Ujjayi, or victorious breath. And this will inhale through both nostrils, but you'll hear a kind of ocean-like sound by drawing and opening the glottis. We'll inhale. And then exhale. Two more times. Inhale. The breath slows and deepens. Exhale one more time. And one last time. Inhale. And then exhale. Now, a lot of the research on anxiety and yoga, and specifically yoga breathing, suggests three things. One is if you're going to use this method called Ujjayi for reducing anxiety, the focus is on lengthening the exhale. So you can inhale and then exhale, say for a count of 6. Your inhale may be a count of 4, and exhale for a count of 6, lengthening the exhale. Again, another facet of this research is to try, Dr. Richard Brown, I believe he's at Columbia, suggests getting the breath down for adults for managing anxiety to about 5 or 6 breaths per minute. So if you were to practice that with or without this Ujjayi sound, you would try to slow the breath down to about 6 seconds for each part of inhale or exhale. And this you do over time. So that would be inhaling 2, 3, 4, 5, 6, gentle pause, and exhale 1, 2, 3, 4, 5, 6. So you try to work with that count of 5 or 6 seconds for a number of repetitions. So a couple of minutes a day. You can try to get the breath ratio down sequentially. It might be 10 at first. And what Dr. Brown suggests for children is to not work with such a short ratio, but to try to work between 8 and 10 seconds, 8 or 10 breaths per minute. Now, another thing that's really useful is having some kind of self-care or self-massage. I'm going to share with you something that I'm looking to continue research with, which is Tibetan yoga. And it's probably received the least research of any of these mind-body disciplines. And someone I know or reached out to, his name is Dr. Alejandro Chowell. He did a number of studies with oncology patients working with some of these basic forms of Tibetan yoga. And the specific form of Tibetan yoga is called Neijung. And I teach it to my patients. And it's a form of self-massage that you can begin with inhaling into the low abdomen. And if holding the breath is difficult, if you have high blood pressure or pregnant or have other conditions, we generally don't hold the breath. But a lot of these methods involve gentle holding of the breath, retaining the breath in the low abdomen, if that's possible. I'm going to go through some self-care massages and then do some Qigong to close. So we'll inhale. And we'll start by bringing your left hand up to the mid-brow and massage 7 times. And then exhale. You can inhale again and massage the top of the head 7 times to 21 times. And exhale. And to begin to release neck tension, inhale, interlace the fingers, and bring the base of the palms together at the occiput as you start to massage the head and the neck. You release your hands down and exhale. Now, I don't suggest holding your breath for this, and start with a short range of motion. We're going to start with cervical rotation. And if you have any neck problems, either be gentle or skip this one. But you'll inhale and rotate 3 times. Clockwise, 3 times. Counterclockwise. Back to center and exhale. Extension and flexion. We'll have you inhale, bring the chin up, down, up, down. One more time, up, down, back to center, and exhale. Inhale, rotation, bring the chin to the right, to the left, right, and left. Notice we're doing this slowly. And if we're working at a desk, we'll have you inhale, bring the right palm and grab this upper trapezius muscle. And as you massage the shoulders, bring the shoulders up and down. 7, exhale, inhale again. Bring the shoulder up. 3, 4, 5, 6, 7, and exhale. Now, if we hold a lot of worry in our chest or feel chest tension, this practice of swiveling the shoulders, of course, we're doing simple practices today. You'll inhale, feels comfortable to hold the breath, and bring the shoulders down and release a lot of that worry. And exhale. Next is a waist rotation. So we'll have you inhale and rotating around at the level of the navel. You'll inhale, rotate 3 times clockwise, 3 times counterclockwise, and then exhale. I'm going to come to standing and show you a little Qigong, some of the routines I do with my daughter. And let me know if you can hear me. One of the beginning practices of Qigong is called shaking. And what you'll do is plant your heels and relax the whole body. And you can do this first thing in the morning. And you start by bending your knees. And it'll look a little sloppy. It's definitely something you can do with the kids. And start to bounce and shift your weight and rotate right and left. Continue to bounce and keep your heels on the ground. And then finally slow down. You could do this for 2 or 3 minutes. Allow the body to settle. One of the main things about Qigong is we relax all the muscles. You can inhale, bring your arms out to the side. And then exhale down to the center as you bend your knees slightly. Then inhale again. And exhale. Now, as a form of mindful movement, inhale, you can bring your attention to different areas of the body. For example, we work with sensitivity in the hands, but we always root the breath in the low abdomen. We bring our mind and attention. Inhale and exhale. Now, to cultivate sensitivity in your hands, you can step your feet apart as if you're holding a ball. Kids love to work with that imagery. And as you inhale, expand this ball, but connecting it with the low abdomen. Exhale as you contract this ball. Inhale and exhale. One last inhale And exhale. So I think we're running out of time here. I want to share one last. How much time do we have left, Amy?
Sorry, I think we have about 15 minutes. Can you hear me?
Yes, absolutely.
Okay. We have about 15 minutes. We have a few comments. So if you have
Why
some more
don't
to say, go ahead.
Yeah, why don't we work with some, address some questions or comments?
Sure.